Hi everybody, I'm Laurie Cadden, and we are here in another one of the great rooms of TCMC with a westerly view out my window, which is great, and anyone who knows me know I'm all about the west side, so that makes perfect sense. But we're here for our second segment of the Lackawanna County Medical Society's Public Health Education Series. You got that, Dave?
Sure.
All down. But we're here joined with me today to talk to you a little bit about medical emergencies. As we said at our last show that the next segment would be on medical emergencies. We have a wonderful guy who I met last week and happy to see him here again. His name is Dave Isgen, and he is a PA with Medicus Urgent Care in Dunmore.
Correct.
And you've been there a little over a year, Dave. How are things going up there in the land of medical emergencies?
Wonderful.
Yeah.
Wonderful. Busy.
Busy. So because we're going to try to educate the public a little bit about what to do in a medical emergency, where you should go. Should you go to a hospital? Should you go to an urgent care? What is your plan? How are people notified? We're going to go over all of those for you today. Dave's going to help me in doing that. And hopefully when you finish watching this, you'll learn a little bit more about what is a proper procedure. And do you need to go to a hospital or an urgent care because you've been hurt in some way? See, Dave, if you ask me when it comes to anything, I refuse to go no matter what. So that just happened. So that's not good either, right? Yeah, I know. So tell everybody, what is a medical emergency?
Medical emergency is something a situation that a patient would need immediate evaluation and treatment by a medical professional. And there's different levels of emergency, and that's where urgent cares and emergency rooms come into play. So
since we went from there, tell everybody, why would you go to an emergency room versus an urgent care, or vice versa? How does that work?
You can go to both for certain emergencies. And an emergency room would be medical emergencies ranging from strokes, heart attacks, severe abdominal pain, infections, things like that, all the way through to fractures, to needing sutures and things like that. And in an urgent care situation, we see similar situations. Obviously, we're not meant to treat heart attacks and strokes and things like that, but we do see fractures and strains and sprains and lacerations and burns. And there's points where a patient will come into the urgent care and we may not feel comfortable treating them in that situation, and we could refer them to the emergency room. So
are there times when someone may come into you thinking it's not a heart attack or it's not this, and you look at them and you know, and then you've got to call an ambulance to get them? That happens too.
Absolutely.
Because a lot of times, as we know, the risks of the symptoms of some of these things, people think they have nothing, it's nothing. And then they end up being something more severe, which then you can detect. Do you think it's often easier when they do come to you versus going into an emergency room of a hospital? I
don't know if it's easier as much as it's a different setting.
Yeah.
So the wait time may be a little bit less. And we sort of, in an urgent care setting, we're attuned to our setting, so we know what we can treat, what we're comfortable treating. So if a patient comes in with signs of severe abdominal pain, nausea, vomiting, fever, and we suspect appendicitis, we're going to definitely send that patient right out. If it's something like a fracture, we can x-ray them on our site and determine if they can be treated in our facility. And then, from the insurance standpoint, is there any difference in that, or is it treated the same? It's dependent on the specific insurance company and coverage. Our urgent care accepts only certain insurances, so we may not be able to accept everyone's insurance there. But the patient has the option to pay out of pocket too. Okay. So then when a medical emergency takes place, we know in many cases, which we talked about in our last show, the health literacy, or the medical literacy, health literacy, what people know, what they don't know about their own health, how to be a self-advocate. What do you find the cost that goes along with people who don't know, coming in using services that they may not need? How do you find that your business helps people understand, or do you see, let's put it this way, do you see a lot of that happening where people come in and they really don't have a firm grasp on what their health
coverage is or what they understand about their own health in general.
Sure, absolutely. And I think that's where, as providers, we have to educate the public, not just necessarily on prevention and things like that, but actually what's going on, what certain symptoms mean, what certain signs mean, where some patients will come in and they don't understand their medications and how whether taking the medicine or not taking the medicine is going to impact their health. And a lot of patients will come into our setting and they'll say, oh, I feel silly, should I be here? And that's our job. I don't think patients necessarily need to be the ones thinking that they make the decision, should I be seen for this, should I be evaluated? If that pops into your mind, then yeah, you should be evaluated and let the medical professionals figure out what's wrong and what sort of treatment you need.
The only problem with that, though, is if they sometimes, I'm sure you see, where they are there and they really, it wasn't, and maybe it's better to be safe than sorry.
Sure,
I guess we should all err on the side of that. But the fact that the costs are so expensive for these, if they had known a little bit more, maybe it would not have necessitated a visit.
Sure, and that's where you see some patients that may come in with a cold and their symptoms just started earlier that day and they may want to be seen right away for an antibiotic, and that may not be appropriate at that time. Again, it may just be assuring the patient they may not need specific treatment. They may just need, fluids and rest and some Tylenol, some symptom control.
Which their grandmother could have told them.
Sure, absolutely, absolutely.
Instead of going, that's what I mean. I mean, a lot of times they don't. They don't have to do it.
Sure, but I think they also have that peace of mind that, okay, nothing is, there's nothing seriously wrong with me.
And then they leave much more calm.
Absolutely.
Okay. Do you find, and I know that works, I know with pain and being excited and being hyper about things, when somebody's blood pressure is taken, say coming in, they're scared, the blood pressure spikes. Do you, if that happens in a case where it really isn't anything but they've worked themselves up, do you then is it best then to just let them sit and then they're monitored before you actually will let them out? Even if it's nothing, they've worked themselves into that frenzy. Now you have to protect them from anything else.
Sure, and a lot of patients will come in, and especially if they've rushed over and they've waited, a period of time, their blood pressure may go up, and you let them calm down a little bit in the room and you reassure them and you recheck it. And if it's still elevated, if it's something serious, then you may need to treat it. Otherwise, you may just say, you need to follow up with your family doctor or have them come back in for monitoring.
And I like to say, and it's a question that we talked about in the little preliminary stuff we did about how do you protect yourself, and you can say how do you protect an emergency, an accident, it's an accident, how do you do that? But I'm sure someone in your profession, someone who sees this, you've been in this, doing this a long time. You also, as we didn't mention earlier, I didn't mention, you're on the faculty at Marywood in the PA department. You've been there part-time since 2007-ish and full-time since 2013. So you see a lot of that, you're training PAs, you're seeing how this works. Are there kind of regular standards that a mom tries to teach her child or whatever to really be careful about things when you're on a ladder, when you're sitting, bending, all those things you see in doctors' offices? Do you think people listen to them? Are they really valid? How does that work? Because you are trying to prevent yourself from people to come in and see you.
Sure.
Even though I'll come in and see you just to say hi. But
sure.
What do you do? What do you think is your best advice for that?
I think things happen, unfortunately, and we all do have mistakes and
bend over,
and things happen. So as much as careful as you are, seat belts and airbags in cars and car seats and things, people still have car accidents. People still slip and fall, and it's hard. And you try to educate patients and family members about how to properly lift things and safety, wear helmets and pads and things like that. But accidents still happen.
No matter what.
Yeah.
But really, you should try to think
absolutely.
before you move sometimes.
Exactly.
But I know, I'm admitting this to you all, but I know the older I get, you used to move certain ways with muscles and you think nothing of it, and then now you'll do something and think, wait a minute,
what did
like
just do?
I used to be able to do that and not have an issue at all, or I just pulled something, I think, and I think, how did I do that? So no matter how careful you are, it could happen.
It still could happen. Again, there's certain things where you just you know, I stress this to my students too, is there certain things where there's no excuse. You know, you should, if you're in a motorcycle, wear a helmet.
Exactly.
If you're playing a sport, make sure you have protective pads on, warm up and things like that. But
because
you know.
I see too, and I'm sure you've noticed, professional football players who aren't wearing protective knee gear or anything, and that's like the worst. Why do they how do they do that? I mean, why wouldn't you take every precaution? I get you, motorcycle guys and gals. Feeling the wind blowing through your hair, if you have any, is a great feeling, and it's, you know, I can imagine that. But like, protect yourself.
Absolutely, absolutely.
And think about that.
Yes. And that's what I think what's hard too is, you know, patients take it upon themselves and say, you know, I'm not going to get hurt. I know what I'm doing. And sometimes, you know, things happen. So you know, you don't judge them when they come in, you know, and they're hurt.
You don't say, you know what, why did you not wear that helmet? Or why did you not do that?
And usually they say that
you want
about
to,
themselves.
Though, don't you really want to say it?
Not really. They usually say it for themselves.
Okay,
so.
and you agree wholeheartedly,
Sometimes,
right?
yeah.
All right, so in an emergency action plan, should every house, we know that businesses have emergency plans, whether it's to evacuate in the case of, or just if something flat out happens to someone. What is the best way to have an emergency? Should your family, seriously, like you would do for fires, we all meet here, we all know where we're going to be when we get out, those kind of plans. That's an example of one. But from a medical emergency, how do you recommend people go about doing that, especially if you live alone?
Sure. Continuity of care is a big thing. So if your family doctor goes to a specific hospital, that's where you should go, or try to go. If you've gone to a specific healthcare center, an urgent care or an ER, your records are there. So it's a lot easier for the providers to track you that way. But communicate. Tell your family and friends where you would like to go. Tell your family and friends.
Medicines you're taking, right?
Exactly. Have things written down, contact information, and it's something you can carry your wallet or your purse. And it really makes a huge difference. It's not only a time saver, but it really can have a positive impact on the patient's care.
So then, in case of someone who's, because it really doesn't matter, young or old, you should know. Lisa was saying, our girl Lisa was telling us when she runs, because we could see the tan from her what do you call it, her wrist information piece that she has on from running, that it's because you don't want to carry anything when you're running. I don't want to carry anything anyway, let alone running. But you put that information because you just never know. Someone needs to get in touch with you.
And I think that's, again, patients tend not to think like that. We don't want to, we don't want to think that that's going to happen, but it certainly can. And
so in that case then, to alert someone if there is an emergency, you always should have something, whether it's in your wallet, whether it's in your purse, of who is a family member that can be reached. Because that so many times I'm sure these things happen, and you're going through someone's wallet or whatever to find out. There needs to be some type of a plan. Beside that, what else do you recommend?
Having written any allergies and the reaction to those allergies, medications, current medications that you're on, and that needs to be updated periodically, because some patients will come in with 20 different medicines that they were on in the past but not currently on, and it's hard to sort through that. So updating everything periodically with new phone numbers, cell phone numbers, and things like that. The more information the providers have in that type of emergency is really going to be helpful.
So, and you choosing to do this and being part of Medicus and urgent care where people are there, how has it changed your perspective on what you used to do versus where you are now, and what impact does it have on the way you relate to the patients who come through the door?
From the time I graduated as a PA in 2001 until 2013, I was with gastroenterology. So it was a specialty, and I saw a lot of the same things, and I got to know that really well. And now in Medicus, it's much broader. So I'm seeing things that I didn't have a lot of experience with in terms of dermatology and orthopedics. So it's a challenge, but it keeps me on my toes, and it keeps me learning, and it's a nice challenge. It's a nice change.
And wanting to know that, because to do that, like you said, you're like, for lack of a better term, a GP in many ways. And that, I mean, because you're experiencing every symptom
Yes.
from every part, from every subspecialty to whatever. You never know what it's going to be. So you're saying, as simple as something with the skin,
Sure.
you've got to know pretty much everything. And if you don't keep up on it, that could be crucial to the person walking through the door.
Sure, sure. And what's nice too in our facility, it's a really good team, and there's a lot of collaboration. So you can ask questions and you know, have a second set of eyes look at something and give you their opinion as well. So it's really an exciting place, and it keeps me fresh for my students too. I'm able to bring in real
all
life
your information. Yeah,
to the students.
that must be wonderful for you then, Dave, being in that setting and teaching these young people who, or some of them are a little older, making a second choice of what they want to do, right? What do I want to be when I grow up? A PA, and I'm going to Marywood. So you do these things, and so what you bring from working there gives them firsthand knowledge of what that's like.
And it's a lot easier, I think, to learn something if you have something to relate it to. So the stories that I tell, you know, based on whatever we're learning, I think it helps reinforce that with the students.
And we have to say big shout out to your old guy, my buddy, Dr. Chris Barbarevich. I just love him to pieces.
He's a good guy.
He is one of the nicest guys. And you say they're all good, which they are. I just know he's the only one I know personally, but what a guy.
He's wonderful.
Yeah.
He introduced my wife and I, so that's a whole
you
other
have
story.
To like
yeah,
him, right?
absolutely, yes.
For the third segment, I think, our third series on public health.
Matchmakers.
But yeah, that's terrific. And so what would you, before we close, Dave, what would you tell the public that something maybe I didn't say, is there anything you'd like to leave, what note would you like to leave on for people to better understand what to do in case of a medical emergency?
If it pops into your head, do I need to be seen for this? Then yes. Do I need an ambulance? Yes. Never second guess those sorts of questions. I would rather have a patient come in to be evaluated and be told everything's fine, rather than somebody at home and wait a day or two, which happens, and the outcome isn't so good.
Yeah.
But yeah, the gut feeling is really important.
So, anything else?
No, stay well, stay
Stay
healthy.
well, stay healthy, do it all. And so, do you want me to say anything on that? Because that could, yeah. So if someone, before we do, one more thing, because Lisa's given us Vanna White stuff on the side, which is good. What, on the symptoms of stroke or a heart attack, obviously that is an emergency situation. Yeah, get there. What can you say on those two subjects, though? What is important to know and the differences?
In terms of stroke, any sudden change in balance, change in speech, numbness or tingling in extremity or the face. If a family member or loved one recognizes that the patient isn't acting right, doesn't seem right, is having fainting spells, severe headaches, things like that. Those are all worrisome for strokes. In terms of a heart attack, obviously chest pain, but it could be shortness of breath. It could be nausea and headaches, sweating,
and
dizziness.
different in a man and a woman, too,
There's
right?
definitely differences in between males and females with presentations. We think of the classic presentations of heart attacks, but there's definitely differences between men and women in those.
And you actually, obviously being in this, you actually see that that's true. Sometimes when you hear, there's this in a man, there's this in a woman, you think, I don't. But seeing it is believing it.
Yeah,
obviously.
and you'll see patients come in and sort of your clinical judgment comes into play and says, this doesn't smell right. There's something up with this patient. This isn't just an asthma attack.
Right.
You know, this could be shortness of breath and cough and maybe a heart attack.
And so in a situation like that, those type of symptoms, it's always better to go right to an emergency room.
Better be safe than sorry, absolutely. Right. And go right to the emergency room.
Yeah.
And again, we'll have patients come into an urgent care setting, and the only thing we may be able to do is stabilize them and call an ambulance. But obviously we can evaluate for that. But if there's any question of a stroke or heart attack, the emergency room is the absolute right place.
Okay. Well, Dave, I thank you.
Thank you.
For your time. It's so nice to meet you.
Nice to meet you.
Like I said, our last texting with Miss Jennifer Line, it's one of your favorite
She was a wonderful student,
right?
absolutely.
big shout out to Jen. So thank you so much.
Thank you.
You have a wonderful week, and everyone, thanks for listening and watching and paying attention. We hope you learned a little bit more about what to do in case of a medical emergency. And Dave Isgen is a PA at Medicus Urgent Care in Dunmore, and he also teaches on the faculty of Marywood University in the PA program.
That'll be new for next year.
New one, yeah, we'll do it. Since 2007 and full-time since 2013. So look for us again. This will air for a little bit, and next month we'll be bringing you our third segment of Lackawanna County Medical Society's Public Health Education Series, and we're happy to do it here at TCMC with the Westerly View. It's a great place to be. Mark, I like your choice, and I hope your back feels better. He pulled his back out or something yesterday. He was home resting, he told me. See? An emergency, but he knew what to do. He said, I'm resting. See?
There you go.
It all worked out. So thanks for listening, everybody. We'll see you real soon. I'm Laurie Cadden. Have a great week.